The Health Matters Nakuru County Governor Kinyanjui has raised a red flag over the surge of Covid-19 infections in education institutions in the county. Kinyanjui revealed that at least 46 Covid-19 deaths were reported in the education sector in August alone.
During the month under review, 41 persons were under ICU care and an average of 110 on oxygen support. The governor urged the public to turn up for treatment in public health facilities, noting that the county government has so far waived medical bills amounting to over 500 million shillings for COVID-19 patients since March last year.
The month that has just ended, that is the month of August, was our worst month since the first cases of COVID-19 were reported here in Nakuru. In particular, we lost a total of 196 people across the entire Nakuru in the month of August alone.
The health department in the county blamed the spike in COVID-19 infections to late reporting despite treatment being free in public health facilities.
The medical staff have noted with great concern that a majority of the people who seek help, medical help, are coming rather late. And the reason that is the case is that there's a lot of self-diagnosis going on, which means that persons who think they're having symptoms that are suggestive of COVID would rather self-medicate, self-diagnose, and only when it gets too serious is when they come to the hospital.
Elsewhere, the raging COVID-19 Delta variant has overstretched supplementary oxygen at KBC Teaching and Referral Hospital, prompting county health authorities to increase its production capacity.
I have directed the chief officer to ensure that we put in place an additional 500 liters of oxygen per minute. So she's in the process of procurement.
Inaugurating a new board for the KBC Teaching and Referral Hospital, Governor James Ongwae explained that the county no longer sold the much-needed piped air to neighboring counties owing to the COVID-19 infection spike.
We used to give out the oxygen to the outlying, to the other counties. But now, because a very, very sick patient towards the terminal end is utilizing close to 40 to 50 liters of oxygen per minute. Of course, the normal ones, I'm not a doctor myself, but I suspect the normal ones could be using about 10 or so. At that time, it was possible to, what we had was enough. But right now, what we have is not enough.
The outgoing board was credited for putting up a 300 capacity mail ward used as a COVID-19 center, among other projects. Reporting for Lunchtime News, I'm Amboyo Tiende.